Madam Pinkless, the NCLEX loves newborn questions, but here's the catch. Not all scary sounding symptoms are emergency. At the same time, there's some subtle signs that are very benign, but they are rather red flags. In this video, we're tackling 10 high-yield questions on newborn that test your instincts. We're going to use common sense. It's a newborn assessment to help you pass the NCLEX. You just need to stop overthinking these answers and think about using common sense, things that you know is subtle, but we have to be serious about. So stick around and let me show you 10 questions that you most likely going to see them in your NCLEX because newborn questions are marked, right? This is the number one. I will show you, I'm going to approach it in the common sense. I have no clue what the question is saying. I have no clue what the answer is asking or giving me, but I will show you strategies to figure it out. Folic acid supplementation is important before and during pregnancy. That means I need to take folic acid. Why is it important before or during pregnancy? So which of the following best explain why? One, it reduces the risk of gestational diabetes. Two, it helps prevent anencephaly. Three, it enhances fetal bone mineralization. And it decreases the risk of what? Maternal hypertension. At least after you've been reviewing NCLEX, you're watching videos and everything, you have some idea that folic acid has something to do with what? Neurotube defect, right? Do you see neurotube defect there? No. But that does not mean you should pick something that you're familiar with, right? You know, gestational diabetes has nothing to do, mommy is taking folic acid. It has something to do with glucose. How does folic acid relate to glucose? Second, I have no clue what is anencephaly is, but I'm going to hold on to that. Then go back and say fetal bone mineralization. I know mineral is what? Some form of calcium. And what is he going to do? Help with bone. Does taking folic acid help fetal bone mineralization? I know folic acid has something to do with what? Neurotube defect. But bone, I have no clue. It decreases maternal hypertension. You know you don't take folic acid for blood pressure. Therefore, if you have no clue what anencephaly means, take it and run away. It's just common sense. Like, I have no clue what it is, but just by looking at, I know gestational diabetes, you don't take folic acid for that. You don't take folic acid for your bone. You take calcium, vitamin D. And maternal hypertension is due to whether they have hypertension or preeclampsia. And so when we talk about it, you have to be pregnant even to do number four. Common sense, right? You got to pick number two. And this is an example of what? Neurotube defect, spinal bifida. This is like, it's a brain issue, right? You're losing almost all the top portion of it. So you don't know what it is. You can Google what it means. But this is, instead of me putting neurotube defect, in order for you to pick it, I just take it out and I say, look, I want to see what you think. But that's your right answer. Common sense. This is the same thing. Which of the following findings is expected? So sometimes when you do the questions all the time, practice questions, you're always looking for the negative, unexpected. But sometimes they will give you expected finding. They're asking you for a normal in a 24-old healthy term newborn baby. It's not premature. They spend time analyzing question. He said expected finding 24 hours, and it's a normal baby. Therefore, I'm looking for normal things. Don't make it so difficult. Look for normal things, not abnormal, right? So if you look for abnormal things, you get it wrong. So normal. Kid should not be yellow. I don't know. What do you think? Positive, that means it's there. Babinski. Should I get Babinski? Should I have Babinski after 24 hours? Should it go away? Your respiratory rate is what? 38. At rest, when you're not doing anything, you're not moving, you're not crying or anything like that, right? And when you listen to the baby when he's crying, you hear a little bit of a mama, right? And then when you stroke or touch the soul of the baby, you see the plantar surface folding on itself. It's trying to grasp you. Or you put your hand in your finger in their palm, they're going to do the same thing. If you do the same thing to the soul, it's going to do the same thing. Think about it. Should the baby be yellow? If it's yellow, then pick it. If it's not yellow, 24 hours, then, and by thinking about it, you shouldn't be yellow. Most babies are born not to be yellow. So yellow sclera is not good. But positive Babinski is a reflex that you got it. It takes like 24 months for it to go away. Therefore, that's normal. Respiratory of 68, the baby had a respiratory is like 30 to 60. But if you have rest, you are 68, you're breathing too fast. And then when the baby is just crying and you hear a little bit, mama, yeah, it's a physiological problem. And if you touch the soul, the soul is going to grasp you, that's normal. Therefore, which of them are normal? The baby doing this, and you're hearing a murmur, and you have positive Babinski. This is not normal. This is not normal. Yellow sclera and respiratory rate, they are all not normal. I'm trying to make newborn questions, which you're definitely going to get because he has his own category, health promotion, maternal, newborn, and some risk reduction questions is coming. So why don't you master them? This video will help you some of the content that you need. So next one, I'm taking all the newborn, abnormal, normal stuff, and it observes a 1-day-old newborn sneezing occasionally. Occasionally, the kid will sneeze. What should the nurse do? Stop the video, answer the question, come back, listen to the way I approach it. The baby is sneezing. Notify the provider for possible withdrawal. Check for nasal flaring or retraction. Document the finding as normal. Check the mother's drug history. Let me show you test taking strategy. After you stop the video, answer it your own, look at it. One, he said you should look for withdrawal. Notify the healthcare provider. Are you assuming the baby is in withdrawal? There's nothing in the question tell you is in withdrawal or the mother is in withdrawal, right? So watch for number one and look at number three. Document the finding as normal. Okay, well, sneezing may be normal. Fine. But look at 2 and 3. 2 and 4 actually need to do assessment. If you have to document something abnormal, as normal, and something to do assessment, I would choose an assessment. So checking for nasal flaring, maybe if it's sneezing associated with the nasal flaring, I know it's a respiratory problem, right? Checking for mother drug history, yes. But he's answering the same questions on one that you assume one, mommy is in withdrawal. Therefore, I should check mother's drug history. But at least he's telling you to do some assessment. Is it possibility? But the least thing you can do is see if the baby is having distress associated with the sneezing. And that is what checking for nasal flaring and retraction, because that's what is going to kill the baby. Safety is the key. Number 2 is your right answer. A newborn temperature is 96.8. You know it's not normal. What is the next priority action? What would you do? Warm the baby. Warm the baby. Common sense tell you if you cold, you wear clothes. I'm not going to document this as normal. Wrap the baby in a warm blanket. This is active warming, right? Place the infant skin to skin with the mother. Passive warming, but it's less invasive, right? Call the NICU for transfer. Can you do something on your own? You can do something on your own. And that is 2 to 3, 2 and 3. But which one is less invasive? Let mommy do his job. Skin to skin with the mother, number 3. Which finding require immediate intervention in the newborn? Immediate intervention in the newborn. Okay? 1, a single umbilical artery, right? Absent routine reflex at birth. Central cyanosis when crying and positive Monroe reflex, right? Think about it. Pick your answer. Look at the answers. You may not be familiar with. What does that mean to have a single umbilical artery? I have no clue. Should you have 2, 3, 4, 5? I don't know. Absent routine reflex at birth, right? Routine, like he's ready to what? Eat. When you scroll the cheek, he tends towards that. Food is coming, right? Central cyanosis, the baby look blue, like the tetralogy of Folate. It's not peripheral. Positive Monroe is the startle reflex. We all know when you drop the baby, feel like it's falling. Fall is normal and it's positive, right? Single artery, I don't know. Absent routine reflex, right? Not every baby learn how to cycling right away. So you expect it to be not be there. The single artery is abnormal. You're supposed to have two. Central cyanosis is also abnormal. But the question says, look, sometimes NCLEX does that to test your just common sense and say, hey, immediately, there's a reason why this word is there. It's not designed to just be there. It's a buzzword, right? A buzzword, I always say, watch for the buzzword. Immediate intervention in a newborn. You can do something right now. Single umbilical artery is a problem, right? Can you do something now? No, you're not going to fix it. Absent routine reflex is abnormal, but the baby needs some time to learn how to do routine reflex. Central cyanosis is what? Hypoxia. I can do something right now. Positive Monroe reflex is suspected finding. Therefore, I have three abnormal things, but the one I can do something about it right now is cyanosis. So this is my boy. Number 3 is your right answer. Number 6, a nurse is performing a heel stick on a newborn, which actually minimizes pain and promotes bonding. You can see all these questions. I'm trying to test your critical thinking. That's what it is. Another word of saying common sense, right? Critical, you're thinking critically and say, look, this is what it will be. But what you need to do that is your buzzword. The buzzword is something that is ringing in your ear and it's telling you, it's flashing red light. With action, look at the buzzword, minimizes pain and promote bonding. If I'm picking an answer choice, pain and bonding is my key. I'm looking for what's in the answer choice that is going to do what? Minimizes pain and promote bonding. Use an alcohol wipes prior to puncture. Nobody like alcohol when you put it on your skin. Yeah, it dry up and it give you cooling feeling, but does it promote bonding? It may help with pain, but it doesn't. It doesn't even do pain issue. It's used for what? Make the area clean before you do the procedure. Allow the baby to suck on the glove finger. Okay, to distract them. Okay, I'll pick 2, right? Swallow the infant slightly during the procedure. Yeah, you helping them by swallowing, but tightly. Do you think he likes you? You should let mommy do that. Encourage mommy to breastfeed during the procedure. This is the easy way for the baby to bond with the mother, at the same time get distracted and doesn't care about the heel stick. 4 is the most important, to answer both questions, minimizing pain and promoting bonding. Adapt NCLEX strategy to answer questions in a common sense way. Which of the following is an abnormal newborn finding that the nurse should report? Now I'm giving you something abnormal. So look at it and see, is this abnormal or not? I can give you a clue. All of them are 6 signs and symptoms on the kid. But I said abnormal finding, right? Is it abnormal finding that you can find or something you can see on the kid? That's the word. Buzzword is what? Abnormal. AB normal is not normal. I always learn by focusing on buzzwords and I forget about the rest of the question. Abnormal, AB normal. Therefore, I'm not looking for a normality. Milia on the nose. Yes, some cystic structure on the nose, right? Epstein-Barr in the mouth. The same thing. Cystic lesions on the upper palate. A red reflex in both eyes, right? And the absent reflex in one eye. This is telling you one of them is right. Test taking strategy. I see one say red reflex is there. The other one says it's not there. There's no brainer. I'm going to pick 1 and 2. I'm not even going to look at it, even though I don't know what it is. If you know what it is, then you know those are two are normal. It's benign. You don't need to do anything about it. It goes away. But 3 and 4 said there's a real reflex. The fourth said there's no reflex. It's test-taking strategy. You have 50-50 chance of getting it. But red reflex is always a trap. It's supposed to be there. If it's not there, it's retinal blastoma, or the kid may have cataract. Therefore, 4 is the right answer. But test-taking strategy tell you is between 3 and 4, and 4 is the best answer choice based on content. Same thing. Should the nurse identify as a normal in newborn? Which of the following findings should the nurse identify as a normal newborn? I'm trying to test your mind that you can hear normal, abnormal, normal, abnormal. This is what it is. We're looking for normal things. Substernal retraction, is it normal? Undescended testicles, is it normal? Absent suckling pads, is it normal? Bluish discoloration of the hands and feet. Stop the video, pick the answer, and come back in 10 seconds. 1, 2, 3, 10. Number 1, substernal retraction is a respiratory problem. It's not normal. Undescended testicles is not normal. But the caveat, you may see it in what? In the premature baby, right? Premature baby does not have enough time for the testicles to descend into the scrotum. The word in the buzzword, I always call it buzzword. Should the nurse identify as a normal in the newborn? Newborn, if I want you to worry about premature, I will put premature there. It's a newborn, therefore it's a healthy newborn. It's not there. Premature. Therefore, undescended testicles is not normal, it's abnormal. Absent sucking pads, right? This is what the kid used to feed, right? That means he's going to have a problem with feeding. We got to investigate. Bluish discoloration of the hands and feet is an expected finding, is normal. As soon as you're born, your peripheral circulation is limited. So your hands and feet turn blue. Those are acral cyanosis, and this is expected finding. If you see central cyanosis, then that's a problem. So 4 is normal, and that's our answer. And then care for a postpartum client who report repeated unsuccessful attempt at breastfeeding a newborn. Which of the following actions should the nurse take first? The buzzword is trying to breastfeed. I'm having problem. I'm getting frustrated. What would you do? Do you call somebody for me? Do you teach me how to do it? You let me physically forget about it? 1, encourage the client to pump the breast and feed it in the bottle. Refer the client to lactation consultant that can teach the patient how to lactate. Assess the newborn suckling reflex. Figure out how the newborn is suckling. If he's not catching on the breast well, do you think you'll be able to feed? I'm giving you a clue. Reassuring the client that breastfeeding often takes time to be able to be successful. I'm giving you a clue. This is how you answer questions as you read it. Something should be triggering in your mind. The common sense should come. I don't know what is going with the parent, how they cannot feed the baby. You've not watched them. You've not asked them anything to figure out. This is why mental health questions, concept can be very difficult. This is one of them, strategy to answer this kind of question. Always in the mental health concept, ask for more questions, right? Ask for more. Figure out what is wrong with the patient. Same thing. He said, I'm having problem. I can't successfully breastfeed. Stay back. Mommy, tell me more. What are you doing? Are you holding the baby? How is the baby suckling? How much breast you make you're giving them? Are you able to even breastfeed on one? So telling them to pump and then feed it in the bottle does not address the question, answer the question. Consultation, what? Lactation consultant, of course, he will teach. Can you do something? He's going to do the same thing that he's supposed to do. Look for the baby, how is the baby is suckling. Look for how the mommy is doing the technique of breastfeeding, how the baby is latching, and you can see, oh, this is the problem. In the beginning, if you don't know how to latch, and the baby does not know how to latch, and the mommy have to hold the baby tummy to tummy, is a problem. Reassurance does not address the question. So, best answer, what you do, help with the baby, figure out the suckling technique, and we'll be fine. Last question. Which a nurse is assessing a newborn immediately after delivery. Which of the following finding is the most concerning and require further evaluation? All of them may be bad, but one is the most concerning. If I'm taking the test, I'm going with this most concerning feature. And which one is most concerning? The baby head look slightly misshaped. Only one testicle is felt in the scrotum. The baby's eyelid is slightly drooping on one side. The baby closes both eyes tightly when crying. You've seen babies before. When they're born, it's a trauma. The head goes through the vaginal canal. Do you think the head of the shape of the head is going to be normal? No. It will slightly be misshaped, but it will come back on its own. Only one testicles, I told you, right? In the scrotum, you may indicate premature, but can you do something about it? Most concerning, right? 1 and 2 is a problem, but it's not most concerning. Prioritization 101, you got to be sharp. The baby's eyelid is slightly drooping on one side. Bowel trauma. He has a cranial nerve palsy. I got to figure out what is going on. He closes both eyes tightly when he cries. That's what the baby does. You have 1, 2, 3 that are abnormal finding. Which one is more serious? The cranial nerve injury or the testicles that is not descended or a head is not misshaped? Think about it. You can see we have nerve injury. You got to figure out why. Number 3 is the right answer. This is Adapting Class 10 questions are yours, testing your common sense newborn assessment designed to give you concept. You need to master them. If you need help, check Adapting Class. I have a bunch of videos on newborn, a bunch of playlists. You should watch them because they're coming. The NCLEX are not going to be forgiving when they give you newborn cases. Take care of yourself. If you like this video, share, subscribe, join our membership to learn more. Good luck and best of luck. Keep charging and never stop charging. Bye.